call, I just want to note that Brent and I are here in the room. And Shelley is online in Phoenix or wherever the heck she is in Arizona. Where in Arizona is it again? Tucson, that's it. Yeah, okay. So approval of the agenda. Is there a motion to approve? Agenda. And do we have anybody? I second. Public participation? Is there anybody online? Looks like it's just Beth online and Shelley. Is that it? Yeah, okay. Approval of minutes. We have the October 10, 25 Finance and Audit Committee.
I move to approve the November minutes.
That was the October minutes.
October.
Do we have November though? That's a good point. They weren't ready.
Yeah, there's the November.
Yeah.
The October ones we're not putting there.
Huh?
So the November ones are in there. The October ones are not.
So the one I'm looking at online is the October minutes. The one the one that is the packet I just downloaded. Huh, okay, so they must have just got swapped out. So, okay, so let's just to cover our bases, let's do an emotion on the October since it's in here, and then we'll do November too. So
I make a motion to approve the October minutes.
So are your minutes, look at your agenda there.
The minutes say that you approved October and
They do? Okay, so we're good on, all right. Okay, so November, let's leave that one alone then, Shelley. So November minutes. Motion.
I make a motion to approve the November minutes.
Okay, second.
Great, all right. Okay. September financial report. Angela.
October financial.
I wonder if I'm having such a hard time. I was having an agenda up here. There we go. Golly, man. Like, I'm just so jealous of Shelley that I can't, it rattled me here. So, okay, here we go, November minutes. Okay.
You have an agenda.
Yeah, okay, I've got it. I was just, for some reason, I'd opened the wrong PDF. Okay, so October financial report, Angela.
Okay, so I'd like to start, thank you to the chair. I would like to start with an overview of some regulatory and cost report changes that we've received. So we have put in the initial fiscal year 25 cost report for Bartlett as well as for Wildflower Court. The demand letter is at the end of the packet for reference, and that resulted in a $1.1 million payback to CMS. There were a few reasons for that. It was primarily driven by the realignment of service lines and the reduction in cost and overhead in the hospital, which created the profit margin that we all experienced and enjoyed for fiscal year 25. Of course, the counterbalance to that is we owe some back to CMS because they're going to take their portion back since we did better than anticipated. There was also the $1.2 million shift of overhead from Wildflower Court, or from the hospital to Wildflower Court. So when we spoke about this last time, it was to support that improved swing bed rate for Wildflower Court to improve the reimbursement there. So we did that on purpose, knowing that there would have an offset on the hospital side. We originally paid back that $400,000. About $400,000 of that 1.1 in this CMS payback is attributable to that. And that's so that we could get an overall annualized $2.3 million lift. Now we had anticipated them going back and making it retro. They chose not to do that. So our actual lift for fiscal year 26 is 1.62 million. So I'll bring all these numbers together. I know I throw a lot at you when I'm talking through these different data points, but I promise you I'll bring it all together. Okay. As another end result of fiscal year 25 cost reports being filed, Our Medicaid reimbursement rate decreased from 47.43% to 44.3%. This is about $1.5 million impact. So what we're looking at with all of this and the previously discussed rural health demonstration funds that were not renewed yet, 4.2 million. We are, what's my numbers? We are looking at an annualized impact of about 7.6 million in decreases with all of that fun stuff happening. Now we have some offsets. So that's a bad news, right? That's the ugliest picture we can paint. The offsets are the 1.62 from Wildflower Court that we were able to achieve by shifting 1.2 million of costs we already spent from the hospital to Wildflower Court where it belongs. So this is all the administrative overhead. So we got that lift from Wildflower Court and it improved this recovery, 1.6 million. If we are able to get the rural health demonstration funds renewed, that would, if they're at the same rate, be about 4.2. So that's a big chunk of that impact. So if we took all those and offset them, then that would bring us down to about a net impact of 1.8 million. And that is relatable to just the reduced reimbursement from doing better. So no good deed goes unpunished. we did better, and there is a counter effect of that from CMS reimbursement. Any questions on that piece? That's just a high level overview of the different regulatory and reimbursement changes that come through.
So I guess I don't know if this is for Joe. What is the latest we're hearing about rural demonstration? Any new information there?
Well, I've been talking to both sides, Gaussians and Sullivan's office. They both feel that they're confident that it'll either get extended in December or January. They said they're writing letters on this, so we don't, until that happens. I've been promised things by them before, so.
Yeah.
Another thing to Angela, part of the One Big Beautiful Bill was there was a slight bump to outpatient Medicare. And we expect roughly 550,000 in initial Medicare reimbursement, and that goes into place January 1st.
That perspective?
Yeah, it's prospective. It's OPPS, so it's
Okay. So I guess the postmortem on FY25 was that, or are we to a postmortem yet on FY25? Are we still kind of calculating the impact of everything the auditors are kind of working on the FY25 final results?
We are. I do have an audit update after we finish the financial
Okay.
piece.
Great.
Okay. Okay, for the financial review for October. It was almost off the mark. Okay. We had combined annualized impact of October delivered strong operational month. We had gross revenues of 25.3 million. It was carried primarily by outpatient, which included speech therapy, mammography, and physician services. We had a net operating revenue of 12.9 million and closed the month with a 120,000 operating margin. Now, a good chunk of that was because we did have an interest income catch up. Remember, we had missed the interest income accrual in July and August. And so there was that piece of 280K. We did have some heavy expenses, and it was pharmacy expenses primarily tied to infusion pharmacy. We have a little bit of opportunity to optimize some of our medication formulary, and we're working through that process now. And the second piece of the expense was salaries, wages, and benefits, primarily tied to Bartlett Family Medicine. No surprises there. Any questions on the income statement? And I'll move to the balance sheet.
Shelley, do you have anything? Brent? And here I should have asked you this earlier, but why is depreciation so light in the month?
Depreciation, we had a large, this will be part of the audit discussion. We had a large catch up on depreciation and we are normalizing that entry now. So there will be a little bit of when we go to restate the financials from FY25 through October.
Yeah,
We will see that normalize over the months.
okay, that's fine. Yeah, cool.
It's a little high and low on the months right now.
So just to get it on the table, so the interest income that we've reported for October is really the whole first 4 months of the year, right?
There was some that was previously booked, but some like in July was missing the interest income.
Okay, and is that like the market? It's,
Yes, that is the
okay,
CBJ provides that
Yeah.
interest rate and we calculate it.
thank you.
Balance sheet, the cash decreased to 30.6 million. That is about $1 million decrease from the prior month. 805,000 of that was we paid down AP, so vendors were paid. And 372,000 was an increase to accounts receivable, so cash not collected yet, but collectible. So our collections are continuing to recover in October and November. We have that seasonal pattern in September and part of October that shows a decrease in collections, same thing we saw in prior year. No surprises there. So it is just a seasonal pattern. It is not a structural concern. We'll continue to monitor closely, but it is standard business. So outlook for headwinds, the hospital reimbursement rate increases, Medicaid share reduction, the payback that we had to make. Tailwinds, we have the wildflower court reimbursement increase. We have the strong outpatient volumes, which continue on the trend and follow what the organizational strategy intended it to. And what's pending is the Rural Health Demonstration funding renewal. We've had indications of positive renewal, but until we see it, I guess we're all from the Missouri state, show me, they won't believe it. The expense trends remain expected, manageable. They correlate to the revenue growth and the actions that we've taken. And our audit is near completion. Any questions on financials before we move to audit?
Shelley?
Nope.
Brent? No. Page 13 on, let's start with home care. And I guess we kind of think about them together, but so why is home care, you know, we're running at about half of our line 19, our total operating revenues, a little less than half of what we had for revenue for budget. I'll just throw it out there while we're at it. But, and you've got about a quarter of the budgeted revenue in sitting in hospice. You know, why are we so lagging so badly on that?
We have some significant issues with the billing organization for home health, for hospice. We are working through that process. We are going to bring the billing in-house. There are a couple of things that we need to do to make that happen. One is to ensure that we have the back end portion of it set up. So our clearinghouses and the loading files so that we don't have any hiccups on our end. And then the second piece will be bringing the coding in-house. So we have full control of the billing, but we have to get our coders certified for home health and hospice. So we are getting them certified under the applicable requirements there. But we will be taking that over to ensure that it's billed timely. For example, in November, there were no collections for home health and hospice because they did not bill anything until the end of the month. And there is no excuse as to why it wasn't billed. It was simply, it wasn't billed. So there's a lack of accountability and ownership on the billing company's side.
So we can expect to see a catch up on these lags, or is there a risk of losing revenue because of the timeliness or incorrect coding?
There could be a risk of losing the funds, but we will try to recapture everything we can. I don't fully have my arms around it yet, but I am actively working to find out where we're at with. I had a meeting with our PFS director earlier today to discuss it.
Don't we, I think the state Medicaid has a general rule that you've got a year to submit a claim, is that right?
Mhm.
Fairly certain that's the
Yeah,
case.
both
right?
Medicaid and Medicare 12 months.
12 months, yeah, so we should be okay,
We should be.
yeah.
As long as we have proper documentation, then we can get all of the information, we should be okay. But yes, until I'm for certain, I want to vouch to it.
Yeah, don't promise.
So how far out is the, will you be, I mean, until you start billing on Medicare, Medicaid, how much time are we talking about here?
It is potentially 90 days.
Okay.
We have to handle a contract breach and transition.
You mean cancel the contract and then?
Yes, but under breach of contract.
Is that in process? Have
Oh.
you started that?
We're working through the details now. They have initially indicated that they would be amenable to transitioning it over to us, but then it has stalled and it's become push me, pull me. So we're trying to figure out, do we need to initiate that step? We'll have that in short order. And if so, we'll move forward with canceling that.
Okay. Would you just keep us apprised monthly until we get this thing worked out so that we know where we are? I want to get it in the minutes too, that I just want to make sure it's reflected that, you know, we inquired about that. We've got issues with our billing department and our billing entity, and we're working on bringing that in-house, and that, you know, we expect to have improved revenue once that's done. Is that a fair way to summarize that? Okay. The other question I have you had any conversations with Bob Bartholomew about hospice and home care?
I've had one conversation with Bob. It was a few months ago.
Just not recently. Okay, he called me not too long ago, and I just, you know, told him that, I think operationally we're doing okay with it, right? I mean, is that?
Well, I think it's staffed and where our census has been up from previous, so we should expect, based on the census, a higher revenue.
So it's a little bit of a disconnect between
Yeah.
what we're seeing on the paper and the way it's, yeah. Okay. Thank you. Next.
Any other questions before we move to audit? So the current state of the audit. The auditors have found some issues, and there are some items of note that will be corrections. We are finishing that work. We expect the entries and the initial work to be completed by end of week next week. And from there, they will put together the final financials as well as the letter to management. The amendments are not all from 25. So fiscal year 25 isn't the full sum of the issues. We have found material changes that go back to fiscal year 24 and prior. To the extent of preliminary findings, the revenue cutoff for Wildflower Port of 600,000. So it should have been revenue in fiscal year 24, but was booked in fiscal year 25. So they didn't properly cut off at the end of the year and book it into the proper year. The city had closed out some fixed assets on their side that did not get closed out on the Bartlett side. There was a bit of a communication issue, and that resulted in 1.2 million in depreciation catch-up. And that refers to fiscal year 22, 23, and 24 primarily. The third-party settlement liability should have been 2 million at the end of fiscal year 24. It showed a receivable of about 350, 390,000. So a big swing. Most of that was already captured in fiscal year 25, so that is not a pure hit flowing through. But it was a prior period issue. So a lot of moving parts still. We will have final reports. We will have information that outlines what all these adjustments are, why they occurred, the supporting sheets, what time period they applied to. But just to give you a brief overview, there will be some findings from the audit.
Are we restating fiscal year 24? Or are we?
Potentially. We are going to look at the analysis of restating fiscal year 24 versus starting with a different net position in fiscal year 25 and flowing it through. Part of that will be looking at the financials. The other part will be analyzing it for past report.
So I appreciate the fact that you guys are doing an analysis to identify, how to properly handle these as to which period they're recorded in. The cutoff, the first time you talked about, which was the revenue cutoff, that should have no impact on the cost report one way or another. That's just revenue, right?
Right.
The depreciation would potentially have impact on that. And then the third item having to do with, accruing
Third party settlement.
the settlement also wouldn't impact the cost report, correct?
I don't think we would capture that. I have not validated that before, and I have not gone back and validated the line.
Intuitively, you think it would because it's not a cost side thing. It's just a matter of booking that settlement.
Right, it's a result of the cost report.
Yeah. So, okay, well, for Shelley or Brent, you guys have any questions before I tee it on? So I appreciate having the analysis. Will we have final reports by the January Finance Committee meeting?
I believe so. That is the intent.
And the auditors can come talk to the Finance Committee?
Absolutely, and to the board as well.
Yeah, okay. So I just want to build that into our agenda time, we'll add it a half hour, let's say for that, just to make sure that we're allowing enough time for them, and we'll put them up first on the agenda before your presentation, just so that they, be respectful of their time. And because there's nothing more important than auditors.
Your bill.
Yeah, well, that's the other part. So that when we get the FY 25 results, I'd like to have this kind of an analysis of here's what we had when we reported June results in our August meeting. So here's what was given to the board then, and here's what it is now, and here's what the differences are, and then we can have a discussion as to why, right?
Yes, so a P&L walk, and we intend to have that for fiscal year 25, as well as every month we have published.
Oh, great, okay.
I think it's important that we have that lined out at, several months, maybe roll forward. But at least to have it lined out so it's transparent and clear as to what we did and when.
Yeah. And as part of that, I appreciate you bringing these issues, but I'd like a very clear written summary to put into the minutes about the adjustments that they found and what those are. So, here's what our adjustment was, debits and credits, and here's what what we think the cause was.
Right.
And I'd like to have that for the finance packet for the January. It doesn't have to be long-winded. I'm thinking a bullet point or two, maybe, on each one. But I want to make sure that we really understand what the, kind of the condition was that created those errors and, and also potentially why it wasn't found by audit.
Absolutely. And subsequent to that, we will also have an action plan that outlines items we have already fixed and then plans to adjust anything else to address where the root cause problem existed.
Yeah. So have they told you you're going to have like a significant deficiency or material weakness at this point? Or no?
Not fully stated it. They've indicated we likely will have a significant deficiency on cash controls and perhaps a material weakness.
Okay.
So there will definitely be an action plan involved.
And that has to do with the interfund settlement with CBJ, I assume, or is that?
Interfund reconciliation, the timeliness of that reconciliation, and then the accuracy.
Yeah, which we all knew. I mean, we've talked about that before, so I mean, that's not necessarily a surprise, so.
Right.
Okay. Anything more from anybody? Questions or comments?
Yeah. So any idea what the net effect of these errors or that were discovered will be on 2025?
There are still a lot of moving pieces, so I'm not close to a final number yet. We've had some up and some down. I don't have that, but I will communicate that.
Great. And I've asked, just to say it, I've asked for a meeting with just me and the auditors and Angela and Joe. So we'll have that before. We gotta be careful about, but I want to have a thorough discussion with them about some of this stuff. So we'll do that before our next meeting. And I assume you want to have them come to the full board too, right?
I think that this will be our first year with the new auditors.
Yeah.
I think it'd be appropriate
Agreed, yeah.
that we need to meet the new.
So we should build that into the January board meeting too. Yeah, great.
And just for contextualizing, there were some communication issues. There was some timeliness of recording issues, which are all being addressed. But this is reclassification and recording. This is not a cash issue. There's nothing missing.
Yeah.
There's no malfeasance. This is accounting and presentation and accuracy. So just wanted to make sure that we bracketed appropriately.
Thank you for pointing that out. That is a good thing to focus on. So. Okay. Anything further, Angela?
No, thank you.
Housing update.
So over the course of the last 30 days, we've engaged with Wayne Jensen. He's given us some preliminary drawings. We've gone through and kind of had Aaron, Chad, and Angela go through and kind of break down things a little bit as to what our needs would be. And so we submitted those back to Wayne. The next step will be to get an actual survey done. So we're working through the foundation on that piece, to have it surveyed to make sure the drawings are accurate. And then, so we're hoping that sometime in January, we have some cost estimates based on those drawings. Then we'll try to do the actual survey plan for presentation purposes. This was something we discussed with the Department of Health yesterday. So there is some renovation funds available through the One Big Beautiful Bill. They'll be coming forward. They made the comment that maybe this is something they can present to Medicare directly as just a one-off. In the rule, there's no new construction, but there's renovation. So they're trying to figure out what that means between the two. So there could be money for it, could be partial money for it, could be no money for it. So we'll see and watch that. So continue to work on that. Housing hasn't been much of an issue from an HR perspective. We haven't had being the time of year it is, I think it's much easier to get housing. So I think the problems alleviated, not like it was last summer. Knowing it'll be a problem next summer for sure.
Questions for Joe? So the existing versus the new, so is there some remodel that needs to be done to the existing? Thinking about specifically the ones that look and feel more like a hotel room, adding, we touched on that a little bit. You were going to kind of investigate that some more, but should we be doing some work to make those, small mini kitchens for, it's kind of what I'm thinking, right?
We can look at that. The first kind of our first go at is just a shuffle of where the rooms are. So right now we have patient rooms on both floors. And so the thought process being that we put patients all on the first floor with the expansion. So there'd be 9, the same number of rooms or more rooms than there are today, but they'd all be at ground level with all the employee rooms be on the second floor.
Gotcha.
And so it'd be a complete remodel. And so we can look at putting a mini kitchen of some sort, and then there would not be bathrooms added to them at this point, just because of the plumbing issue, but we can look at it.
Yeah, might as well. I mean, if we're doing it, let's at least, I mean, if we exclude it because of cost, then okay, but let's just kind of, I think it'd be good to look at that.
We can discuss it, yeah.
I did talk to Wayne a little bit about this. I saw him somewhere and he was thinking he might get 8 units out of the new.
Wait, I thought they were in 6.
It was adding 6 because we were setting them up like a triplex. And then taking the apartment and splitting it, adding a second bedroom into it.
Excellent. Okay. Okay, great. I'm glad that's moving forward. Good. Wow, look at this, man. We're just cruising through. Committee comments and questions? Shelley?
Well, I think for me, as I'm ending my time on the board, when I signed on for this in my first finance and board meetings, I really wondered where we'd be but at the end of my 3 years. And I am so surprised and happy to see that all the hard work that's been done has put us in a much better place. So strong work to everybody.
Yeah, that's an excellent point. Hard work by staff and the board has just been kind of following it along, right? I mean, you know, it's Joe and the staff that have just done incredible work, I think, too. So that's totally noted. But didn't you hear that the assembly isn't going to be meeting again as HRC for 6 months because they're going to be focusing on budget? So your term got extended through June.
I didn't hear that, but you'll be seeing me in my backyard every time.
And there's a snowstorm coming to Tucson. You have anything, Brett? No, I don't have anything further. We're adjourned. 32.
4:03, it's on, I heard.
Yeah.
That's what I heard.
Yeah.
See that?
Or not, Brent.